Good afternoon, everyone. It's 4 o'clock. We'll get started with our reopening task force for Wednesday, August 11th. First, I want to thank this task force for their work over the last several months in the broadest sense of gathering input from our various constituencies, and then even more directly in providing your guidance and feedback to me, and being flexible over this last week. We had a meeting scheduled for last week, but I think as we've all noticed, conditions have changed and things are changing before our very eyes in our state and in our country. And frankly, I needed more time to gather more input and more guidance from different folks. And so I appreciate you being flexible. With that said, there are some people who are unable to join us today because of the reschedule. But just to review our process, today I'm going to be going over the draft of what will be my recommendations to the SAU school board next week. As our community knows, our SAU board ultimately has to approve any recommendations I make that involve policy decisions, and then our individual boards have the ability to weigh in as well and make decisions for the schools within their particular districts. And so this process today, the purpose is to get final input from this group of people who represent the various constituencies in our two communities for the purpose of informing my recommendations to our school board. And so I'm going to go through that plan in some detail. Before I do that, we have someone on here today from Ginkgo Bioworks, which is the company that has been hired by the state of New Hampshire to administer the state testing program for schools. And so Ben Rome is here. Ben, thank you for being here. And I'd like Ben to first share with this group, with our task force and our community, the testing process in general, so that we can understand how the process might work, as well as how it's working or not working in other towns, other cities, and other states. So Ben, with that, I'm going to turn it over to you.
Yeah, absolutely. Thanks, Adam, and thanks for having me here. Nice to meet you all. And yeah, so just briefly, kind of context here, we're working directly with the state Health and Human Services to provide testing through the Safer at School screening program. So the state is covering the cost of any testing, as well as additional support through some federal funding that's been allocated to the states. And just in terms of us, Ginkgo Bioworks, we pivoted a big portion of our platform last year to COVID testing, and really since last fall, have been pretty exclusively focused on the K-12 space. So in addition to our partnership with New Hampshire HHS, we have statewide programs in Massachusetts, Maine, Arizona, California, North Carolina, a number of other places. So yeah, let me give kind of the brief overview of what the testing generally tends to look like, and then happy to take questions or talk about particular areas. So really, I would say the testing program is kind of made up of four key elements. The foundation of the program is pooled testing or cohort testing, and so what that is basically you're combining individual samples from up to 25 individuals, so an entire classroom, a sports team, whatever it may be, into a single tube. The sample itself is collected via a lower nasal swab, so just the inside of the nostril. And generally what we've seen is kindergarten and above can self-swab comfortably, and then for pre-K, special needs, or those that aren't comfortable, that's where you can have a nurse do an assisted swab. And I'll talk about it in a minute, but part of the program, we provide nursing support as an option for schools that want additional support to come on test day and run the test day. So basically the way it works is, each student swabs their nose, puts that swab into a tube at the front of the classroom. That tube gets labeled. It doesn't include any personal information from the students. It just gets labeled, as Mrs. Smith's class or girls softball team, whatever it may be. That tube goes to the lab via courier that we arrange. Goes to the lab. It's a PCR test. And then you get a result for that classroom or that team, obviously positive or negative. And kind of to put it in perspective, last year over the course of the school year, around the country, we saw a pooled positivity rate of around 1%, a little bit less than 1% actually. So 1% of classrooms, a little bit less than 1% of classrooms were coming back positive, right? So 1 in 100, 1 in 150 pools coming back positive. Now, kind of the second element of the program is, okay, so you get your result back, now what? So, if it's negative, obviously that's great. Vast majority of them are, continue about your day, about your week. If it's positive, that's where we then do a follow-up individual test to determine which person or persons in that pool is positive, right? And so to do that, you'd utilize the Abbott by Next Now rapid test. So that's also same thing, a lower nasal swab, but test is run right there at the school, and you get the result in 15 minutes, so that you can know which individuals are positive and need to take kind of the appropriate action in terms of quarantine. The third element of the program is the staffing support, as I mentioned. So what's great about the federal funding is it specifically calls out funding for additional support, knowing that a lot of school administrators, school nurses are overburdened already, before you even start talking about testing. So we work with a network of nurses and healthcare professionals who are trained up on our test, on our system. They're very familiar with it. They come to the school on test day each week or each 2 weeks or whatever the frequency is that you choose to run testing, and help run the test day start to finish. And then lastly, the digital portal that we use, so where you receive your results, and for the individual tests where you run those tests, where you scan those tests in, handles all of the required reporting. So like, as you may know, basically for any individual diagnostic test, results need to be reported by law to the Department of Public Health. The platform handles that automatically, so administrators aren't, filing the manual paperwork with the state or anything like that. The program is opt-in, of course, right? So, parents, obviously for anyone under 18, parents have to consent to participate in the program. We provide consent forms. They can either be signed electronically, so you can basically, schools can send out a link to parents where they can click in via email, review the consent and sign, or for parents who don't do email or who prefer paper, obviously there's a paper form as well. So I'll pause there. That's kind of like the super high level overview of the program. Happy to either take questions or talk more in depth about particular elements of it.
Thank you, Ben. So I am going to open it up to the group. They have seen, this task force has seen some of your literature and has had the opportunity to understand a little bit about it. To be clear for the community, there is no testing of any student without informed parental consent for that every specific student prior to testing. So there's no way that the school would be doing testing, nor would we support that. Even if it was possible, we would never test a student without a parent opting into that specifically. And with that said, I'll open it up to this group if there are questions from this group. Mr. O'Keefe, and then Anna Perrell.
Thank you. Ben, just two very quick questions. Number one, how many districts in Southern New Hampshire are currently doing this? And then number two, how effective is this in terms of actually trying to keep in check potential virus increases in a school setting? Because it's more of a reactive type thing, because the virus is already present with a positive result. So how effective is this in preventing additional disease, or more importantly, spread?
Yeah, absolutely. So yeah, to your first question, I know like throughout the state, we've talked to probably 15 to 20 districts in the last couple of weeks. So I think a lot of schools are still deciding like how they want to proceed for the fall. We recently started Londonderry, just signed up. We recently started getting them onboarding. And we also had a second call with Manchester yesterday. So I know they're still kind of deciding on their approach. And then, yeah, in terms of your second question, right? Like how does this help? What's the effectiveness in kind of limiting or stopping the spread of COVID? The way that I would think about it is there's kind of like two separate but related benefits to doing this type of testing, right? So one is, I would think about the testing as generating data, right? So right now, in terms of being able to make kind of informed decisions about safety measures in classroom, whether that's masking, distancing, other things, like we're kind of just relying on data about community prevalence of the virus. And so doing a testing program such as this one allows schools to get a snapshot week over week of what the positivity level of the virus is in school, and how that is changing up or down over time, and how it's changing as you choose, should you choose, and as you choose to add or remove different precautions, right? So whether that's masking, distancing, etc. In terms of kind of the spread and you know the other way to think about it is like picking up cases early to try and prevent spread. So the pooled test itself is a PCR test, so a highly sensitive test. So generally, you know, the idea is that you can generally pick up the presence of the disease, you know, before symptoms and early in the kind of process of developing the virus. What I can say, you know, obviously I don't, anecdotally from the work we did last year, what was very encouraging, in addition to, you know, the fact that less than 1% of classrooms were coming back positive, but we were not seeing a lot of in-classroom spread. So by that I mean, like when a classroom tested positive and you identified the positive individual or individuals, we weren't seeing much at all of that classroom then testing positive in subsequent weeks with other individuals. So that's obviously anecdotal, but I think like the way that I would think about it is it's giving you the information to be able to know that that's the case, and not that you know, you're having a lot of spread throughout the community.
Hi, Ben. I'm the elementary principal, so I guess mine more along the lines of a couple things. One, how many students have to opt in for this to be effective? So I'll start there.
Yeah, great question. So first I'll say kind of more the better, but there was actually an interesting study done that I can share. This was like a published study that basically showed that even at 20% participation, which is quite low, kind of the range of communities that we've tested with, you still do get a good benefit of the testing. And you can think about that as like, you're basically doing a 20% sampling of your community to, again, have get a sense of what the level of prevalence is of the virus. Generally, from our experience, what we've seen in this varies community to community, but, you know, often what we'll see is week one, you know, consent rates are 30-40%. And then as, you know, parents get familiarized with the program, and we help provide kind of a lot of resources, having seen what the most common parental concerns and questions are. We help the schools provide resources to communicate that out to parents. And then generally after, you know, a week or two, as parents become more familiar and kind of see and hear how the program is running, you start to see consent rates go up.
Thanks. Sarah, just one more question first. So just again, for that pre-K, K population to fourth grade, just wondering, with your experience with those schools, how much time is it taking? I'm sure Deanna, the nurse, is going to jump on here and just ask about the assistance piece and then follow up. So I think it's more about that, just actual time that it's taking out of the class.
Yeah, absolutely. And so we really designed, like, the two design principles of this program, right, were minimize classroom disruption and minimize burden on school administrators. Like, that's the only way you can do testing in schools. What we generally have seen is you can test an entire classroom in 12 minutes, often less. Probably like 12 minutes the first week, and then you're 10 minutes, sometimes even less than that. That's kind of the benefit of doing this pooled test, where it's, for the most part, self-swab. You're not collecting any individual information. Each student is putting their swab in the tube, and then they're done. And then, yeah, in terms of the kind of workload and load on the nurses, we definitely encourage schools to take advantage of the state-funded staffing support. Just makes everyone's life easier. And then, if you decide, like, we designed the program before all this funding came down. So we did design it with the idea that schools were going to have to use existing staff. Now, obviously, we encourage folks to take advantage of the funding for staffing. But, once you see the process, you can decide, yeah, we'll keep that, or, oh, we'll actually just kind of do this ourselves. It's pretty straightforward. So that's up to you.
You good, Anna? Can I ask? Okay, thanks. Hi, Ben. My name is Sarah Lawrence. I'm the chair of the Mount Vernon School Board. I want to get a sense of what this would look like actually in the day. So let's say you do this. When are you testing a classroom? Let's say, are you testing them in the morning?
Yeah,
or when?
Good question. So it's up to the school in terms of like how you want to schedule it. So we work with you to say, like, if you're assuming you're having staffing support come on site, right? We work with you to understand like when you want them to show up, basically. Most schools will do it in the morning. And there's a couple of different ways. And again, like, we can kind of work with you to figure out what works best. There's kind of like two common ways of actually doing the testing. So often, like in elementary schools, maybe middle schools too, like, you'll basically have the nurse or the person that's coming and doing the support kind of going class to class, like with a cart, something like that, to quickly do the testing. And then in high schools, some schools will do that, but some schools will do, because like students are moving around a bit more and are kind of capable of bringing themselves from one place to another a bit more. You might have a central collection place where students can go, at a designated time or throughout the day to put in the sample.
Okay, so there's no guideline based around when the testing happens and then student movement after the testing. So let's say you test in the morning, and then that class of kids, clearly a little bit less so with the elementary, but that class in high school or middle school could potentially be all over the building with a million other people throughout the day. Is that correct?
Yeah, exactly. So for
Okay.
the like middle and high school where there's not the natural cohorting, right? Like, the way that I would look at it is it's really a more efficient way of testing a large number of people.
Okay, and what's the turnaround time on a test? So you test, let's say you test at 8 o'clock in the morning, what time's the test result come back?
Yeah, you test at 8 o'clock in the morning, and say, we work with you to arrange the courier, but say the courier comes at 9 or at 10, picks it up. That'll get to the lab, in the middle of the day. And then you will have the results back within 24 hours of the lab receiving it. It's often faster. So, the next day, say in the midday, early afternoon.
Okay, so I just want to work through the process. So you've got kids being tested one day, they're being tested, the lab results go off, they come back the following day, 24 hours later, you've got the same kids coming back. If there's a positive person, then what happens? Then you suggest individual testing, and you're suggesting that happens on school premises?
Yeah, so there's a couple ways you can do it. So I would think about like kind of two scenarios, right? One scenario where the result comes back in school hours, right? Like while the students are there. That's actually the easier one. You have the rapid test on hand, and you run the individual rapid test with each individual that was in that pool.
What about the ones who are not opting in?
Yeah, so they obviously don't have consent to be tested, and they wouldn't be tested either in the pool or in the individual test. Obviously, you would still need to do contact tracing, want to do contact tracing to understand like if those individuals are close contacts, and you know, informing the families, but you wouldn't do an individual test on them.
Okay, so I just want to flesh it out a little bit to make sure I'm super clear on this process. So you've got then a positive class. So this class, let's say it's 20%. So of the 20% that opted in, if they want to take that rapid individual test, they do that. Let's say those rapid results come back and none of those people are positive. So then you've got this portion of the class that has not opted in where somebody may or may not be positive depending on your false positivity rate. So I want to understand what happens at that point. Do the entire class get sent home? Are parents contacted? I guess that's the part that I'd really like to flesh out. And I don't maybe need you to do that, Ben, but I want to wrap my head around that process, because you talk about minimal classroom disruption. All I see is classroom and learning disruption here. So, okay, I'll defer to the next person. Thanks.
Yeah, sure. And look, the one thing I'll say is, so ultimately, right, like those policies are up to the district to determine how they want to go about it. You know, I think what we've seen, right, is that one in 150 of the pools are coming back positive. So you're able to basically identify that and stop that from spreading further. But yeah, completely see your point.
Right, Deanna, then John, and then Maddie.
I just wanted to kind of pick up where Sarah left off too. Question that I had is, so you do the pool test, 24 hours, it comes back. In the meantime, those kids have been everywhere in the school building, everywhere in the class, everywhere outside of the school, which isn't your fault at all, but I'm just saying that that's a concern I have with that kind of testing. But when you come back to do, if we have you guys come back to do the testing of the kids that have opted in, it's the rapid test. Now, my understanding of the rapid test is that you get accurate results if there are symptoms. It's not very accurate for asymptomatic cases. So this could very well be asymptomatic cases, since I hope it's asymptomatic if the kids are in school.
Yeah.
So why is that? Why would that be considered accurate?
Yeah, it's a great question. So Massachusetts, who ran basically this exact program starting last January, they actually did a study, and again, I can share that as well. But basically, they did a study on whether or not the Abbott Binax Now test was effective in picking up, in basically deconvoluting or understanding who in a positive pool was positive, and did find that in the vast majority of the time it was effective. And again, I'll share that study. I think like if you're doing the Abbott test as a broad surveillance strategy, you end up statistically with a lot of holes, false positives, false negatives. If you're testing it, in a group of, if you're using it for a group of 10 to 20 individuals where you know that there is a very high likelihood, given the sensitivity of PCR, that there is a positive individual, the efficacy increases. But I would also just say, like, yeah, look, none of these, to your kind of first point about like the student going all around the school and stuff, like none of these measures, whether it's testing, masking, distancing, et cetera, are like a silver bullet, right? Like if they were, we wouldn't be here. And so the way that I would think about it is really like it is kind of layering different safety measures on top of one another to create the safest possible environment.
The other question I have is, I'm working at the elementary school, so that's the only students that I'm really looking at with this concern, is the assist that they may need to do this test on their own. I understand that you said you have been successful with kindergarten and up. I can tell you some kindergartners that it's going to be very difficult without assist. Preschool, there's like, I think there's about 15 kids in a class, so it's going to take probably more than 12 minutes by the time a nurse comes in and helps out. And hopefully we would take advantage of having, if we do this, a nurse come from out of district to do that type thing. I just see a lot of disruption as well in the school day for some of these kids. But I guess it's more than a comment than a question, but.
Yeah, no,
that's better, I guess.
For sure. That's definitely fair. I will say, like, we've been surprised, like the younger kids often tend to be actually better at it than the older kids. Like they're engaged, they pay attention. For sure though, yeah, like some kindergartners, to your point, may need the assist. And yeah, in those instances, it may be longer than the 12 minutes. I can share kind of like we have some videos of like what it actually looks like, just to put a little more color to it. Yeah.
You don't have to share a video of them doing the nasal swab. I'm sorry. And you said Londonderry is the only district that's signed up so far, and Manchester's a potential. Is that what you-
Londonderry, Grantham, but yeah, we've been talking to.
Okay.
I think we've talked to like a dozen or more in the last week and a half.
Okay,
So I
thank
think,
you
like-
for joining us to answer these questions. Appreciate it.
Yeah, of course.
John and then Maddie.
Great, thanks. I looked at a question about the frequency of testing. Is there a limitation on the frequency? The indication to us is that it's frequency that we can decide. And I mean, so is there a limitation on that? I mean, twice a week, too much, or more than that, too much?
Yeah. So to your point, ultimately it's up to the district and the school. I would say most commonly, like 80-90% of the time, it's weekly. But some schools are doing, every other week. Twice a week, haven't seen it as much. Some are doing it, more often. It's like if it's a hybrid scenario where half kids are in, you'll do like 2 testing days a week, but generally once a week is mostly what we see.
But there's not a limit in terms, if we wanted to do it twice a week, that's within the parameters of the program?
Yep.
Okay. And then just to be clear, I thought I'd heard you say at the beginning that the test results will be back in 15 minutes, but that's for then it's 24 hours. So the basic pool testing, if I understand correctly, is a 24-hour turnaround. And then the rapid test is the 15-minute confirmation or whatever.
Exactly.
Okay.
Maddie.
Thank you, Adam. So I'm just a little more curious how this applies to a high school setting versus an elementary school setting. As I feel like throughout the day, like I'll attend like 7 or 8 different classrooms. So I'll be interacting with 200 plus students versus 20 students. And I was just kind of wondering, like, if I'm in my advisory and I take one of those the contact pool tracing, and one of us in our advisory tests positive for COVID, would everyone who interacts with that student throughout the day, including those out of the advisory, be contact tested or contact traced and then tested individually as well? So like the students that they eat lunch with, the students that are in their AP US history class, et cetera, et cetera.
Yeah, so basically it would be the same, like imagine it as kind of the same scenario as if one of your classmates tested positive like outside of school because they were symptomatic and received a positive test. Again, like not to be a broken record, like it's basically like whatever the district's policy is on contact tracing, that's how the school most likely would handle it. I think from the Health and Human Services, the state's recommendation is basically anyone within 3 feet distancing would be considered a close contact. But yeah, I think the best way to think about it is like the same way a school would handle it if an individual tested positive outside of the classroom.
All right. Thank you, Ben, for that. I appreciate it. You're welcome to stay on and continue in case other questions come up, but I'm sure you have other things to do as well. So either way, I can reach out if there's any follow-up questions, but thank you.
Okay, yeah, perfect. Thanks so much for inviting me. Yeah, I'll jump out, but please do feel free to reach out if there's other questions, and happy to chat more.
Very good. Thank you.
Okay.
And just I want to share my perspective on testing, which is going back to March of 2020. One of the first things that was described as being something that could help stem the spread of COVID-19 was testing. And if folks might remember, South Korea was lauded because they did extensive testing at first for COVID-19, and they were seen as really a bright spot. To me, I understand that there's a difficulty in having a lag of 24 hours to get results, but if we didn't do that testing, it's possible an asymptomatic student would spread the virus to several other classmates in that class, and it might be a week or two until someone becomes symptomatic and we realize that we've had an outbreak or we've had an issue in a particular classroom. And so for me, this is information that we wouldn't have normally come across that I think should be helpful to us. And so we'll talk more about testing, I'm sure, but I wanted to be clear, for me, this is us trying to get us where I think we all want to go, which is a normal school experience for our students. So that's my perspective. With that said, let's move on. We can come back to testing because we have several topics to consider today. Before I start going through the revised draft of my plan, I want to share some thoughts from the outset. My goal is for our students to be in school 5 days a week in an unmasked, normal school environment as soon as is humanly possible. The worst case scenario for me is not having to mask students either temporarily or permanently. The worst case scenario for me is students having to endure more remote instruction that don't have to. Our students struggled last year for the parts of our school year when they were remote. There were students who were remote for the entire school year and beyond that we worry about for many, many reasons. I believe our goal as a school system should be to get kids in school 5 days a week in a functionally normal school environment in every way possible. And that's my goal through this process. We're going to discuss highly sensitive and topics that have broad disagreement in our community. I want to make this committee aware I've received several hundred emails and contacts from Mount Vernon and from Amherst, and the views are very clear, and people have extremely strong opinions. And I want to start with what's got us to this place where we have a almost politically untenable decision to make as a task force and as a school district. First, our CDC has provided guidance all along to us as school systems leaders. However, they've also left us in a completely untenable position with their recommendations for this school year, because they've recommended full 5 days of school, masking for all students, and social distancing within our schools. Well, unless our schools grow in size by about twice the number of square feet that we have today, we all know that it's impossible for us to socially distance our students and offer 5 days a week of instructions to our schools. And so while the CDC's guidance is meant to be broad and to deal with the lowest common denominator, their guidance leaves us with more problems than solutions, because we can't follow their guidance. We cannot follow all of the CDC's guidance in our schools if we want to offer 5 days a week of instruction for all of our students. We simply don't have the space to do that. Going to our state level, we have a belief in New Hampshire that local control needs to be reserved in every way possible. And in most cases, I support that notion as well. But let it be said that we are on our own as SAU 39 to make decisions about the safety and well-being for our students. And I choose to see that as an opportunity for us to make what we think is the best decision for our students. Most of the decisions that have to be made, our community has helped make for us. Our community, by and large, supports 5 day a week, full-time, in-person instruction for the vast majority of our students. That's very clear. And so that decision is fairly easy for us. We also know that last year's model of offering a full choice for remote or in-person is not an option this year, because we don't have the same funding that we had last year to staff a full remote environment in addition to a full in-person environment. So in some ways, our community's desire has been matched by our budgetary priorities this year, and limit in some way the choice that we had last year for parents. And that's difficult for some people. And I understand that. There are people contacting me right now, more and more in the last week or two, that feel as if a remote option is in the best interest of their child. And we simply don't have the ability to offer the same remote option that we did in the past. Some other things that are changing factors for our community that are different than last year. We know that vaccinations are available for some of our students and all of our staff, but we have to remember that it's still an emergency authorization for a vaccine. There are still studies underway for kids under 12, and depending on which report you read, it might not be till next spring that vaccines are available for all of our students. It is different than last year when we had no vaccine availability, and we had to leave parental choice as a guiding maxim that helped us determine that we had to have a fully remote option, because some parents were simply not going to be comfortable absent a vaccine sending their students to school. Next, as we've talked about, surveillance testing is available, and it wasn't in the past. Those of us who experienced flu-like symptoms in the winter of 2019 into 2020, and then into very March and April of 2020, those of us who were sick, we didn't have the ability to get tested back in those times because there simply weren't either tests developed or available, even though the guidance at the time was, if you can test everybody, that's the best way to root out infection in our communities. The PCR positivity rate, the reason why we use 1%, or that not we, but experts use 1% as a guide, is because a 1% positivity rate means you're doing enough testing. You're rooting out the infection in a community. And so now we finally do have the ability to do that testing that we probably wish we had a long time ago. The final topic that is a different factor from last year is that masks have become as politically divisive and scientifically disputed of a topic as anything else related to COVID-19. And I've received so many emails that have included studies, references, newspaper articles, and I've been through, I think all of them, and have found that masks are something that there are valid points on both sides of the aisle, both sides of the debate around whether masks should be a requirement for students to attend school. And there are valid concerns on both sides. And unfortunately, it's become connected to politics. And in that way, it's become something that is almost impossible to talk about without vitriol being part of the conversation. Our job as a task force in the school district is to overcome that vitriol and make decisions that are good for the most of our students. Moving along, our community values, as I've understood them, either through conversations with this task force and all of the feedback you have provided as subcommittee co-chairs or chairs, and through surveys we've done of parents, are as follows. I already mentioned that the unfettered access to the in-person environment. And that's something that our community feels by and large. Our community in general feels that masks should only be required when community or schools conditions exhibit risk to students or staff, and that they shouldn't be required outdoors. And again, this is my interpretation of our community's in general perspective on issues. Most parents, when asked, 75% plus, did support the use of masks on a temporary basis if the requirement for masks enables more students to attend the in-person school environment. I asked that question directly. If there's a kid in your child's class that needs your child to wear a mask, would you be willing to let your child wear a mask? And 75% of parents that responded said yes. We've identified that gaps that have happened because of limited access to the in-person environment. Our community wants us to address those at the student level, not the class or the grade level, but at the student level. Most parents, when asked, did support surveillance testing of students, pool testing that we described earlier today. But in general, the overall view of our community, as I see it, is they want to return to normal while accepting and living with the sustained risk of COVID-19. So with that said, my decision-making process about what to recommend and where has evolved and grown with time and has changed, and I want to acknowledge that. And so where I'm coming from today is I believe we need to establish how we're going to work through this next school year and possibly into the future, because I believe we're going to be dealing with COVID-related issues for at least this school year and possibly into the future. And if our community's values are, we want to make the in-person environment accessible to everyone and as normal as possible, by accepting the limited risk associated with COVID-19, we need to find a way. We need to find a way to get there and live with that. So I'm going to share my screen, and I've developed, with your help and input, a more refined color-coded system that I want to talk through, that I'm recommending to our task force and ultimately to our SAU board. So still red, orange, yellow, green, and blue, but some changes from the previous year. And so I want to go over each of them one at a time. Red would be when our campus is closed for in-person instruction. This would happen when we're required to by the governor, by DHHS, when we're told there's an outbreak in our schools and we have no choice. So I don't see us going and having a red status outside of obvious and compelling local conditions. Orange would be where we have very strict safety protocols, where indoor masks are required for every staff and student, regardless of vaccination status. I want to pause there and talk about vaccination status for a minute. We are prohibited from requiring students to get a COVID-19 vaccine to access our school. That's a law in New Hampshire that was passed this past session. And so we will not be requiring students to receive the COVID-19 vaccine to access the in-school environment. There will be times where we will likely have to ask parents if they're willing to provide us proof of vaccination status. I chose every one of those words carefully. Asking parents if they're willing to provide vaccination status. It could be that a class, a group of students, a sports team is identified as a close contact for COVID-19. And all of those people who are not vaccinated will have to quarantine for a period of time, be restricted from the in-person environment, be restricted from their sports team, etc. In those situations, if a parent chooses to share their child's vaccination status with us, then we would not have to quarantine from school, from the in-person environment, or from the sports team. And so a parent could choose to not share that information with us, even if their child is vaccinated. That's the parent's choice. They would still have to be quarantined in that instance. Same with staff. If staff members who are in the in-person environment choose not to share their vaccination status with us, they would have to be quarantined if they're not vaccinated or choose not to tell us that they're vaccinated in those situations. But the orange status is, to go deeper on the orange status, masks will be required for all students regardless of vaccination status and for staff, and we'll even recommend that they be worn outdoors when 6 feet of social distancing is not possible, but not require it. We will bring back the daily COVID symptom screening questionnaire for parents. It could be that we simply provide access to it and don't require it, but ask everyone to do it prior to accessing the in-person environment. We know there was lots of people who struggled and didn't like that, but we still would bring that questionnaire as part of our routine. There'd be no access to our buildings by visitors or guests. We would do all parent meetings remotely. There would be lots of smaller protocols that are building specific. The classic one is use of band instruments would be dealt with at the local level in the individual schools. Lots of those smaller protocols. Lunch would be in classrooms, and we would limit building travel where possible. So that would be the orange status. The yellow status, this is where masks would be required for populations who do not have access to vaccinations. And so that would be all of our students younger than the age of 12, but we would include all of AMS. We can't have part of AMS wear masks and part not. That doesn't make any sense. I do want to note here that we assume that vaccination is a once and done process, and I don't want to assume that in our planning. It's possible. I don't know the science behind it. I don't know what will happen, but it's possible that boosters might be something that we have to consider in the future as well. And so vaccination status and availability would be influenced by in the wearing of masks. Masks would not be required for faculty and staff who disclose their vaccination status to either HR or to the building nurse. All parent meetings will be remote and voluntary testing will be completed, as listed here under status yellow there. Green would be that we would recommend safety protocols, or masks would be recommended but not required for anyone indoors. And that's the largest change with the green status. In blue, conditions are near normal and we're not even needing to make a recommendation. What's different this year is I've worked and done some work to understand our different factors and tried to provide a metric system that can help us make these decisions. And these are listed in order of priority. So the number one thing that would affect our school status level would be the number of cases in a given school. So if greater than 5% of the school has active cases at any one time, that's 1 out of every 20 people in the school, staff and students, that would mark that school for that one factor as being red. And then you can see down the list there. Vaccination availability. So if it's not available for a population, that would make that for any of that school's population, that indicator would be orange. There's limited availability, like AMS right now is a perfect example, would be yellow, and Sauhegan would be green. The percent of parents who opt into testing, meaning the number of parents who agree to surveillance testing, would be a factor that would help us understand our risk protocols and allow us to adjust our status. So if greater than 90% of parents agree to surveillance testing, that moves us close to blue, where almost obviates the needs for other measures for mitigation in our schools. Active case count in our town, in a given town, so both Mount Vernon and Amherst. And these numbers are easily trackable. And as we've tracked the virus over the last 18 months, these numbers match up pretty well. When there's a pretty significant issue in town, it's when there's been many cases. The PCR positivity rate by the region, this helps us understand how Nashua is affecting us, how Merrimack and Bedford are affecting us in this region. And then finally, vaccination rate is something that we can also consider. And so how do those factors look as of yesterday? So if we go through those things, school cases, in Mount Vernon Village School, we know it's 0. And the reason we're able to know that is because there's 0 active cases in Mount Vernon right now. And so we know all students live in Mount Vernon. So that's the one we know. We don't know if there's any active cases with our students at this point in time. So that's an unknown. Vaccination availability is limited, is not available for Mount Vernon and Clark Wilkins, limited for AMS, and available at Sauhegan. The percentage of parents who opt into surveillance testing, to be determined. One question I noticed in the chat, a high school parent in here did not see that survey. We'd sent a survey out mostly to elementary parents in the spring. So I should caveat that the 75% number I mentioned before was at the elementary level. Active case count by town, Mount Vernon is 0 as of yesterday, and Amherst was 11 as of yesterday. I did not update that as of today. The PCR positivity rate by this region was 4.2%, which is yellow. And our vaccination rate in Mount Vernon is slightly lower than Amherst. And so with all that said, from my perspective, these factors tell me, again, with the unknowns of how many active cases there are for our school and what percentage of parents would agree to testing if we did it, would put 3 of our schools in yellow and Sauhegan in green. That means that our school year would start at 3 of our schools requiring masks of students and require those students to wear masks until those conditions changed. So going further through this plan, and then I'll stop for questions and discussion, and we can unpack all of these things. We have worked with VLAX over the last couple of weeks. VLAX is the Virtual Learning Academy charter school. They have the availability this year that they did not last year to provide remote instruction to students who cannot attend the in-person environment for either an IEP reason, a 504, or for any other reason. It does not cost our school district anything. There is no cost associated with that. However, we need to have someone in our school district that is coordinating for those students and providing some support to those students during their learning journey. And so our recommendation for an interventionist, both to provide in-person intervention for COVID gaps and to support the students who need this VLAX option. Their job would be split between those two things. Again, we have money that's fully federally provided for both Amherst, Mount Vernon, and Sohegan, for all three, that can fund either one interventionist position if needed, a part-time person, more than one. We have a lot of flexibility with that COVID funding for that interventionist to support whatever gaps we identify in the school, and however many number of students need to be supported through the use of VLAX. I think that's the right option for us when it comes to remote instruction for those students who cannot access the in-person environment. The question is whether we restrict it to students who require remote support because of 504 or IEP reasons, or if we allow other parents to opt into the VLAX remote option through our school system. Again, someone from our school would be coordinating and connecting with them. They would likely have their own morning meeting, similar to what was done last year with our remote sections, and they would still maintain some connection to our school, but it would be through that interventionist position. With that said, our parents, if you're a parent and this plan goes into effect, you'd have the following decisions to make. By default, we would assign your child to the in-person environment. That's a default for everybody. If they have a medical condition that affects their ability to access the in-person environment, they'll need to contact the school and work through that process to be connected through VLAX. Every parent through PowerSchool would have the chance to either opt in to the surveillance pool testing or not. And no parent would be pressured into it. It would be something that would be completely voluntary for our school. And then, as always, parents would need to disclose any pre-existing conditions that mimic COVID-19 symptoms so that we wouldn't have issues in our school. So with that said, I have the decision specifically for our school board after this, but I'd like to turn it over to this group. Again, I want to go back to our responsibility at the local level is to find a way to make decisions that are politically fraught and completely divisive, and find a way to start our school and start our school year in a couple of weeks. So with that, questions, comments, concerns, and issues from this committee? Mr. Glover.
Okay. I generally like the program, the recommendations as outlined. I'm a little bit concerned and have just sort of been chatting with some other Sohegan board members about the masking and the status and thoughts and so on. And there doesn't seem to be strong opposition for doing something at the high school that's a little bit different than what's outlined in your plan. And the basic concept would be to maybe start in a status yellow, essentially. Although, and maybe that's just for everybody. I know the plan for status yellow is masks required for the unvaccinated, but we don't have the ability to know what that is. And the thinking behind it is, for me, the first 2 or 3 weeks would be to just start the school year off with a clean slate and do that in conjunction with the testing program. We don't know where people are coming from their summer vacations. We want to ensure the long-term success of the in-person learning environment, and as a prophylactic measure to clear the deck and get some good test results, assuming that is in fact true, that our assumption is true, that keeps us ahead of the curve instead of behind the curve. Because if we open up the school and a bad thing happens, then we're chasing our tail, and we risk losing the long-term success of the in-person environment. It seems to be a small ask in terms of doing masking again for a short period of time. And if there are opportunities in the schools to have certain classrooms in larger areas and leverage some social distancing, to leverage outdoor learning, for if that works for things, then that would be great. And masking could be optional in those types of environments. And that, for as upset as some people might be about that, I think it's incumbent upon us to do what we can do to ensure the long-term success of the in-person environment. So that's my overall view on your plan, and that's there wasn't anyone that I talked with that was fundamentally opposed to that. I mean, I wouldn't say that nobody's voted on anything. Nobody talked about voting on anything, but the discussions were had about the ideas, and to be sort of prophylactically cautious was seemed to be sensible among most of the people I talked with.
Thank you, John. One thing I skipped over that I want to also bring up for discussion a little bit later with this group is we also need to discuss athletics because athletics have unique challenges associated with them. Close contact is built into some of our athletic events and sports. I shouldn't say events, I'm done with the Olympics now, but our athletic, the sports that students play involve a lot of contact. And so we also have the option around athletics to either one, require students to participate in testing with their teams. That's something that we can require because athletics are not part of the core academic program. Or we have likely have the opportunity to say, if you don't want to participate in testing, then you have to wear a mask when you participate in sports. And so participation in testing is the ticket to remove the mask. But more on that, that's a separate topic, but just to know some of the research we've done. Other reactions?
Adam, one thing that I don't, or maybe I missed it, is what about visitors into the school buildings? I didn't see any guidelines around that. And then the second thing was my input or response to the testing. I agree with the different levels for different schools. I'm not sure that testing has as much benefit as, or I don't see it as having a much benefit as we'd like to see it have, as maybe it's more of a, makes parents feel better that it's a proactive approach, but I don't really see the benefit of that. In our talk with Dr. Chen today, the other nurses were on the call with the Department of Health and Human Services, Public Health Department today for school workers, and they are recommending the same guideline as last year, that if anyone has any symptoms that could be related to COVID, they're being sent home for testing and can't be back till they're tested. If the parents don't want to test, they're supposed to be quarantined for 10 days. So that we just received that guideline today. So.
Beth Kuzma.
If it's loud, let me know. I have one concern that in buildings where we don't have students that are able to get vaccinated because it's not available to them yet. It's been shown lately that vaccinated people at the moment, because of the Delta variant, are able to pass, pass COVID on to those that are unvaccinated. So I have a bit of a concern, students that can't be protected from the vaccine yet. I kind of feel like if masks are required for the students, they should probably be required for staff as well because of that.
Thank you, Beth. Other feedback from this? Mr. Glover.
Okay, well, there's some specific feedback from maybe the high school, and I suppose to a certain degree the elementary school. You touched on it with respect to athletics, but at the high school, and I think Ben had sort of mentioned this, like, and Maddie as well. I mean, it's a very fluid setting with all the athletics and the changing of classes and all the interactions with students. So, for general data, doing the testing would be interesting. I don't know what it's really well outlined. Like, what do we do? What's the protocol for we start getting positive results in the pool testing? at the high school, what does that even really mean? Because, I mean, how do you ensure a learning environment if you're sending kids home? There's no remote option. What does that look like? They're not enrolled in VLAX at that point. They can't just jump into a VLAX. Like, there's a process for that. So I not really sure what it's very clear what we do in those settings when you don't have a cohort that you can manage.
Yeah, so I'll respond to that for both the high school and the elementary level, because they're very different. So one of the byproducts of this past 18 months is we have gained quite a bit of skill in supporting students that are home, whether sick for a couple of days or for a little bit more of an extended period of time. And so an individual student who has a COVID-19 infection and has to be home for a period of time, we would work with that family to support them directly. They would still remain connected through Google Classroom to their class, and we would do what we had to do for that given class. If there's a large cohort of students at Sohegan that are COVID positive, it might be that there are some classes that meet remotely or shift their modality for a period of time while we're sorting that out. It's the same at the elementary school. If a classroom has 9 kids with an infection, well, we're going to make that entire classroom remote for a period of time, and that teacher assigned would teach those classes remotely for that period of time until students could return. That makes good sense. But in general, if a student is positive for COVID-19 or a student has to be quarantined, we're going to be doing it on an individual basis about how we support that student. But the reason there's no guideline, John, is that with how fluid this is, we have to be nimble as well. The way we think the way last school year started is certainly not how it ended, because we learned things around the way and we got better at it. It's the same for this year as well. I just might ask Bethany or Anna to jump in there if you have anything else to add about that on that point. And if not, that's okay too.
Yeah, I think what you said about working on an individual basis, I think it's easy for us if a whole classroom went out to go remote. But we would have to work on some ways outside of the Google Classroom that isn't necessarily something that we're using every day in the class. So yes, agree with you, Adam. We'd have to figure out kind of how we would handle that.
Yeah, and I think at the middle school, we follow a little bit more similarly to the high school than the elementary, and the fact that students move through the day to different classes. So while a whole grade level might not mix, an entire team would. So in the case of our 8th graders, for example, that's 90 kids, 95 kids.
This is different than anything that we've had before, because when kids have been sick in the past, it's been for a couple of days, and maybe a kid's out for a week or two, but that's the exception. Now we're going to have to live with, there are CDC and DHHS guidelines that require students and staff members to quarantine for different periods of times, as long as 14 days sometimes. That's going to be the reality we're going to have to learn to live with moving forward. And again, if our value is keeping the in-person environment open for as many kids as possible, we're going to have to continue to support those kids or staff members that are forced to endure those quarantine periods. Sarah.
So I did unmute myself, sorry. I just crunched the numbers a little bit. So I looked at the current enrollment rates, and I mean, the difference in Mount Vernon for a status red, like it's 8 kids. I mean, eight kids or staff, I mean, 8 people versus for red versus 2 for yellow. Clark Wilkins looks like 32, 19, and 6. AMS looks like 31, 18, and 6. Sohegan 35, 21, and 7. That's not a lot of people. So I feel like if we're using that as our metric, then we really do need to talk about remote options here a little bit more clearly, because especially if the overarching decision is to go towards this pooled testing, which if you read my face, I'm not for that. But the thing that I would say is, in an instant, in a 24-hour span, you could automatically shoot to red for at least a day, if not more. So what are you going to do with all of those people? It's not just those however many 32 kids or students or staff. It could be potentially the entire school population. So that has a huge implication, and I'd like to be able to consider that when we're going forward.
I don't disagree, Sarah. And to your point, at no point last year did we have 8 students or staff at Mount Vernon that had an active case at the same time.
Right.
And so that was one of the things I looked into at each school, was what were the numbers last year that affected our various status levels to gauge how serious things would be. So, but also it's not the only factor. Having 8 positive cases in Mount Vernon isn't the only thing that would turn the whole school to red. It would be that for that one metric in the list, but not all of them necessarily.
Okay.
But it's a fair point. I've received some questions I'd like to try to address. So voluntary testing, what happens when a student tests positive at the high school? Do we provide remote instruction for them, or are they sent home and will have to catch up with schoolwork until they return? And again, this is like any other illness. Student who would be home, we would support. They would need to keep along for a period of time, and we'd have to work in supporting them along the way. What happens if a family member tests positive at another school in our SAU or is in a pool of students that test positive? How are other family members affected at other schools, and how instruction be provided? So part of our process would be notification to everybody. There was a positive pool test and we're doing secondary testing. And so parents would at that point be able to make their own choice, and it wouldn't necessarily affect other family members. How does pool testing work at the high school, where there are individual classes, or will it be done for athletics only? Again, I don't know where it's going to be done. I'm not sure you folks support my idea around pool testing and have the same vigor that I have for it. So I'm not sure it'll happen at all. If it were up to me, it'd be done once a week in advisories to start the year, and then for all athletic teams right from the start. And then we would deal with the results that we got back. If my advisory came back positive, clearly we go to the next step with that group of people to determine who is an asymptomatic case in our school. Back to Deanna's point, you're not coming to school if you're symptomatic. And so that's how it would work. Orange status, how does lunch in classrooms work for the high school? Same as it did last year, with where lunch in the classrooms is less of a reality at the high school, and we would still do the similar protocols we did last year for lunch at the high school. So remote student support, you mentioned an interventionist for other schools and no mention of the high school. No, I do think that the high school also would have that same level of intervention support. And again, we would determine how much is necessary to figure out how the staffing would work there. So those were some questions I received on the side. There's some from some of our participants I'd like to try to answer. What are you going to use for the guidelines for contact tracing and exposure? So I think you've seen that I'm very deferential to our nursing staff. Now they put in an inordinate amount of time attending webinars and researching these issues. They rely on New Hampshire DHHS more than anybody, even more than the CDC, and we would adopt those guidelines moving forward. Deanna, I'm going to look at you for a thumbs up if I'm saying what you believe to be true as well. Thank you. Thank you for the depth of information surrounding how we can expect to move from one color status to another. I appreciate the care taken to ensure minimal disruption and division. Thanks to everyone. I thought there was a question, sorry, but happy to read positive statements as well. If parents are not comfortable with the current level of risk that in-person learning allows, can they opt their children into the VLX option? And so again, that's a question both for this committee to consider and to make a recommendation, but ultimately our school boards will need to make that decision, whether it's restricted to students with an IEP in 504 or for other families as well. If we prove, someone's typing an answer to this, but if we prove vaccination, do our students still need to pool test that is implemented? That's up to you as a parent, because again, we can only pool test if you opt into that into that program. So, and Sarah just said the same thing. Thank you, Sarah. So, all right, I have some specific questions for this group, and short of asking for votes, because we don't have the full committee, nor do I want to put everyone on the spot, but I would like to be able to represent this task force's collective opinion on these topics. And so I'm just going to go through these 5 questions and ask for feedback on any of them. You can feel free to thumbs up or thumbs down if you have an opinion about those questions or ask questions about them. But again, my goal is to, at the SAU board next week, to represent the opinion, not of just myself, but also of you folks as well. So, so the list of factors that affect modality and status, are those the right factors, and are there any missing or any that need to be tweaked or changed? I think Sarah might advocate for increasing the percentage numbers of a school, perhaps, but are there other factors that anybody has that they think should be changed or tweaked? Anybody? Maddie Daniel.
Yeah, this isn't something that would be like a factor into determining the protocol, but as far as the protocols in the school go, what about sanitization? So like basically making sure that like desks are clean, hand sanitizer is provided to students. Where would that kind of play in, and in what status exactly?
Yeah, thank you. So we will not have the same level of cleaning support we had last year. We don't have funding for that we had last year for that extra funding. But our custodial and janitorial staff have received a lot of additional training, and they will be doing much of what was done last year. So I do expect hand sanitizer to be available all year. I do expect PPE to be available to our nurses and to those students who staff who want to wear a mask but don't have them, to have some limited supply like we did last year in those cases, that sort of thing. Does that answer your question, Maddie? Okay, thank you. Anyone else with responses to that first question? Anna Perro.
And I think it goes with that, and something that Beth said too, in with the masking. You know, I think especially at the elementary school, I think if we're saying for all of our kids to mask, then I think that I would say all the staff needs to mask also. And if there's an opportunity for those doing phonics, phonemic awareness, to have some flexibility with that, but it just seems that that would be the right thing to do.
All right, there is disagreement among the faculty subgroup that, and I say disagreement, some of the members that can't be here today have indicated that they don't think staff should wear masks if they can prove vaccination status, and others very strongly still do believe that if students are, that staff are. So we'll have to sort through that one as well. But any other, for the list of factors, anything else there? All right, hearing none.
Beth's got her hand raised.
I'm sorry, Beth, I'm sorry, since your camera's off, I just didn't see it. Forgive me, Beth Kuzma.
That's okay. If I just want clarification with the total community cases, is Mount Vernon and Amherst going to be combined for Sauhegan and AMS really? Because the steps, you know, for Mount Vernon to reach 25 cases or, you know, 100 cases to move to the different levels is very different than Amherst. But when they combine grade, we're sort of one community when it comes to that. So I wasn't sure if that was 20, you know, what is it, 4 to 25 and, you know, 75, you know, 26 to 75 or something like that. Is that combined community cases between Amherst and Mount Vernon, or just those two towns separately?
Yeah, that's a great point. So I'll adjust that.
Clarification on it is all I'm asking for.
No, I think you're right. I think we'll adjust that to combine for AMS and Sauhegan, separate for Mount Vernon and Clark Wilkins. And then I'll do some work to adjust, have one specifically for the Mount Vernon Village School, because Mount Vernon is I think it's about a fourth to a third of the population of Amherst, if I remember right. Good question. Okay. So do you agree with my assessment of the factors as of today that would lead the Village School, Clark Wilkins, and AMS starting the school yellow and Sauhegan green for the start of the school year? Caveat, things could change between now and when the school year starts. Let's be honest about that. This is as I assess it as of today, using those factors we just talked about. Would you agree with that? John would say no. John would want us all to start in yellow. So I'll head him off at the pass there, but continue, John.
Well, that's true. And I would say even more aggressively, now high school has this great saving grace, which is the ability to get vaccination. Problem is, of course, we can't require it. We can't even ask for proof. We can ask voluntarily, like you said. So, you know, if you started off very cautiously and aggressively with, testing twice a week, very aggressively for the first 2 or 3 weeks, and let a gestation period of a virus cycle pass, I think that allows you the opportunity to confidently move back to green and give yourself the best chance of success.
Are there others that agree, or where are you folks at? I need to get a sense of where you folks are at on this. Deanna.
My feeling is, again, I know I've stated before, is going with the CDC recommendations and the American Academy of Pediatrics that all students in K-12 should be wearing masks to start school. Our metrics are going up. We're at 4.6 today, I believe, and for New Hampshire, Nashua and Manchester are both under substantial to moderate levels right now. If you look at the maps on the COVID dashboard, I just feel like I'd rather be proactive than try to, after we've said you don't have to wear a mask, try to back down and say, oh, wait a minute, now we do have to. I think it's easier to take away mitigation than it is to add it.
Thank you, Deanna. Maddie Daniel.
I'm speaking on behalf of myself here and not the majority of the student population, but I was reading earlier today statistics for vaccination availability in students among 15 to 18-year-olds. And this was obviously nationwide, so it could be a little bit more or less in New Hampshire, give or take, but it was around like 45 to 50%. So in a high school environment, that does not create that herd immunity. And I know for a fact that I've been talking to a lot of my classmates and peers, like in ethics forum today, we were talking about vaccines and everything, and people were saying that they want to try to stay in school as much as possible and are willing to do anything to stay in school. I know personally, I will be going to school and I will be wearing my mask this fall, even though I am already vaccinated as a student. And I know there are many other high school students who are willing to do that. Again, this is a very controversial issue, so I'm not speaking on behalf of anyone. But I know I would be okay wearing a mask as a high schooler returning back to school this fall.
Thank you, Maddie. I think most of our community is supportive of what we decide and how we lead. There are folks that feel strongly on both ends of that spectrum, and I appreciate your perspective there, Maddie, very much. Okay, and by the way, the state does publish the vaccination rates for people under 18. I just don't have it in front of me right now, but I do believe it's better than the numbers that you. I think better than the numbers you posted, which is positive. I'm having a hard time reading the rest of you if you think that my interpretation of the factors is on point or not, but I won't put anyone on the spot. Do you believe, Stephen O'Keefe.
Yeah, no, I can be put on the spot. I do agree with your assessment, especially at the elementary school level. The news and the data that's actually coming out of the South, i.e. Florida, with juvenile cases actually on the rise and children's hospitals being sort of maxed out in ICU cares. We need to protect the ones that just can't get any protection right now. So for me and from my perspective, it's a no-brainer. Any mitigation efforts that we can do for the little ones that just don't have a lot of protection is important. I think when you get up to the high school, I think that's kind of a different ballgame. I really do. I think when you've got a certain subset of the population that has had for the past 6 months, some access to those vaccines, and even for our 8th graders, less than that. I think the ball game is a little bit different. We need to empower families to make decisions that are appropriate for them. The testing piece, and I know you're going to get to that in just a minute. I'm a little up in the air on that. I don't necessarily perceive the significant value other than just a data point. The interruption to the school day, the participation rate, which I perceive to be quite low, based on our 2 communities and living here as long as I have been. I don't know if there's going to be a lot of buy-in for that. I think that's something that we may have to come back and revisit, but I think you are on the right spot when it comes to our elementary school kids and starting off in the yellow status.
Appreciate that. All right, hearing no other people quick to raise their hands and share their opinion, we'll move on to the next question, which is around voluntary testing. So, and if I could just ask for thumbs up or thumbs down, do you think it's something I should continue to include in my recommendation to our SAU board next week, or is that something I let go? So you want to provide your thoughts as of today? All right, so this is what we call a completely split recommendation. There are about 3 ups, about 3 no's, and some wishy-washies. So thank you, task force. Stephen.
I will say this, and what I just said about testing, I'm willing to give it a shot on a voluntary basis, opt-in basis, to see how much of a burden this is on our school system, maybe for the first couple of weeks, and then we clearly revisit it. If it's a data point that becomes valuable over time, obviously it was worth the experiment. If it is something that we realize is just too much of a burden, too much of a hassle on our employees, our staff, our kids, and the participation rate is quite low, we clearly can stop it. But to exit it out just because, hey, I don't necessarily agree with it at this point, if there's a perceived value or if there actually is a true value to it, I would like to learn that hands-on versus actually not being able to test it.
Got it. So I will leave that in, but I'm going to share with our SAU board that it was not a strong recommendation by this committee. In fact, it was a mixed set of opinions there. Anna Perrell.
Yeah, Adam, I would just love to really understand more about other schools that have done it. And, I just think in my head too, you're in a class and 12 kids are doing it, 6 aren't, and just that whole implication in a first grade classroom and things like that. So I think I'm also thinking just that piece social emotionally for kids. So I just wanted to kind of throw that's part of my hesitation, just needing to hear more from other schools that have done it.
Very good. And then my final question is, what about athletics and testing? Is that a certain subgroup that should either 3 options? It should be, again, on an opt-in basis. Number 2, it should be mandatory for participation in athletics. Or if you participate in testing, you don't have to wear a mask when you compete. Does anyone have opinions about those 3 options? And Beth Kuzma, you have your hand up. Go ahead, Beth.
Actually, for the last one, I tried turning on my camera and got booted off the call. So the testing for sports, I think because those students tend to have a closer physical interaction with each other, there might be an added benefit to actually acquiring it. Rewinding really quick to the school volunteer option. I'm not sure if we're allowed to, list it, kind of start the year with it, don't get any value with it, or we find it's too disruptive, just stop. So, at least start with it as an option. But for the sports question specifically, I don't see anything wrong with requiring it for those students because it is a different type of environment.
All right, John, Stephen, and then Sarah.
I think we should leverage whatever we're not prohibited from doing to protect the most of our students and give ourselves the best chance of an in-person learning environment that is sustainable. I would extend this program to not only athletics, but also to clubs, and to reach as many students as humanly possible with this incentive to participate, and thereby protect what we're trying to achieve at the big goal. So yes, I'm all in on making that a requirement and doing it as aggressively and completely as possible.
Thank you. Stephen, and then Sarah.
Mine's more of a question. What's the state athletic association doing? Are they mandating or are they recommending the testing?
They are providing no recommendations.
So if we play, let's say Bedford, and Bedford's not doing testing and we can exclude our team because some folks decide not to participate with testing. Is that going to be an issue?
So it's up to the
If
local.
we're going to mandate testing for participation, and you get some football players that say, "Hey, I'm not going to do it," we can't actually field a team for a Bedford game. Is that what you're thinking?
Yes. That's the question. Correct. So the NHIAA is providing no guidance whatsoever. And so individual schools are making their decisions. One neighboring town has decided to require masks for all athletic participation, indoors or outdoors, which means if we play them at their field, they're going to require our athletes to compete in masks. If they come to our field, our athletes don't have to wear masks, but theirs will. And so every locality is making their own decision. I don't find students and athletes wearing masks outdoors has any value. It's not been proven to have an impact outdoors or during athletics. And so I want to be clear, that's not a position I would necessarily support, but I'm trying to gather all of your input. Sarah.
I was going to ask a similar question to Stephen, but since you answered that, I'll ask my second one. And that would be, because athletics meet so frequently, I mean, they practice, they are together almost every day as that cohort in those cohorts. How frequently would you say they need to be tested? I mean, to me, that would almost seem like they need to be tested relatively consistently, week after week after week. So it would be a completely different standard than what you would be holding others to. I just don't know that I'm behind that. But if you want to tell me about what you think that would look like for athletics, I would love to hear what that would look like, because it just seems to me that it would be completely different than the rest of the student population.
Sure. So I will use our Sauhegan football team as an example. Last year, they made it to the state championship game, which was played at Sauhegan. We were the only state north of Maryland that had football playoffs last fall. So we're literally one of the only people that had a state championship, and we got to host it. Most of the football team chose to switch to remote instruction for 2 weeks leading up to their championship football game, because to them, suffering, and to use their words, suffering through remote instruction was better than getting COVID-19 and not being able to play in their state championship game. To me, for our student athletes, what I'm going to describe, in my opinion, of speaking with many of them, is that they would see testing as a nuisance that would be absolutely worth it to them getting tested positive in the week leading up to a big game and require them to be out for 2 or 3 weeks afterwards. So I think most of our student athletes would put up with that nuisance on a regular basis if it ensured that without testing, they become symptomatic 2 weeks later because of that asymptomatic spread that could have been caught with surveillance pool testing. That's my opinion. I could be wrong. Okay, well, that concludes our, maybe not, Bethany, go ahead.
I was just going to say that while we're talking and thinking probably mostly high school athletics, I think it's really important that whatever we decide is consistent through the middle school as well. So I just want to make sure that we're not just thinking Sauhegan with this, but I think a consistent message is important.
Couple of questions in the chat here, and then we'll end for today. And I agree with you, Bethany, by the way. How many students in SAU 39 contracted COVID last school year? So I don't have it broken down students and staff, but it was 157 cases throughout the course of the entire last school year. I'm not aware, and nor would I disclose about any hospitalizations, but I'm not sure if there were any or not. And if I did, I wouldn't disclose that without permission. And then, did I understand correctly that you will decide if you will mandate all athletes to do the testing or wear a mask playing sports? No, that's something that ultimately myself and my board will decide over the next couple of weeks. And again, I do agree that masks outdoors has limited value, if any, according to the studies that appear to be out there. All right. Again, I want to thank this reopening task force. Our job seemed to have gotten a little more serious as the summer went on, but I want to thank you all for sticking with it and providing me guidance and input. If you have any additional guidance or input, please send it my way leading up to the August 19th SAU board meeting, where this plan will be presented with some modifications based on your input at that time. So thank you, task force. This concludes our work for the summer. Perhaps our last summer having to have a COVID-19 reopening task force. But again, thank you to our community for your engagement and your input during this process. And we'll continue this conversation next Thursday. Thank you all.